let's see an NCLEX RN video based on care for patients with thyroid and parathyroid disorders. A patient undergoing surgical resection of thyroid tumor. Immediately following surgery, which intervention has the highest priority? Assessing the surgical site for hemorrhage, supporting the head to prevent stress on the suture line, monitoring respiratory status for sign of obstruction, asking the patient to speak to assess for hoarseness. In the post-operative period after thyroidectomy, the patient is at risk for respiratory compromise secondary to the location of the incision, that is in the neck, potential for post-operative edema, potentially compressing the trachea and inability to maintain airway. So here, after thyroidectomy, we need to monitor the respiratory status for signs of obstruction. Following thyroid surgery, the nurse frequently assesses the patient's ability to speak in order to monitor for which complication: parathyroid injury, hypocalcemia, laryngeal nerve injury, hypercalcemia. Assessing for the damage to the laryngeal nerve is a priority in the post-operative period following thyroidectomy. Changes in the voice quality, particularly hoarseness or a husky tone, may be indicative of laryngeal nerve damage. The nurse monitors for which findings in the patients with hyperthyroidism: weight loss, cold intolerance, constipation, tachycardia, exophthalmos. Hyperthyroidism is associated with an accelerated metabolic rate that leads to tachycardia and weight loss even with increased caloric intake, as well as exophthalmos, that is protrusion of the eyes. Sensitivity to cold and constipation are more associated with hypothyroidism. The nurse monitors for which complication in patient with hyperparathyroidism: renal stones, seizures, laryngospasm, hypertension. Hyperparathyroidism leads to hypercalcemia and hypercalciuria, which increase the incidence of development of renal stones or colic. The seizures and laryngospasm, they are associated with hypocalcemia. A patient with thyroid cancer is receiving high-dose radiation to the thyroid gland. During assessment of the patient, which clinical manifestation is consistent with hypocalcemia? Positive Chostek sign, negative Trousseau sign, absent deep tendon reflexes, periorbital edema. Chostek sign and Trousseau sign are both indicators of low calcium levels. On exam, Chostek sign is twitching of the facial muscles in response to tapping over the facial nerve, and Trousseau sign is carpopedal spasm induced by pressure applied to the arm by an inflated sphygmomanometer cuff. Hypocalcemia is associated with positive Chostek sign and positive Trousseau sign. The deep tendon reflexes are typically hyperactive with hypocalcemia. The nurse recognizes that which patient is at greatest risk for hypothyroidism: a 19-year-old male, a 35-year-old female, a 45-year-old male, and 80-year-old female. Women are affected 7 to 10 times more often than men. Hypothyroidism occurs most often in women between the ages of 30 and 60, and the incidence increases with age. So here, a 35-year-old female is at greatest risk for hypothyroidism. The nurse correlates which clinical manifestation to the pathophysiology of hypothyroidism: cold intolerance, weight loss, insomnia, diarrhea. Hypothyroidism leads to a decrease in metabolic activity, leading to fatigue, weight gain with decreased intake, generalized weakness, cold intolerance, and hypersensitivity to narcotics, hypnotics, and sedatives. Weight loss, insomnia, and diarrhea are associated with hyperthyroidism. The nurse correlates an increase in which laboratory value to the diagnosis of primary hyperthyroidism: thyroxine T4, thyroid stimulating hormone TSH, serum calcium, serum iodine. Primary endocrine disorders are related to dysfunction of the gland and decreased hormonal release. T4 and T3 are thyroid hormones secreted from the thyroid gland. So here primary hyperthyroidism can be found out with the hormone T4. Thyroid stimulating hormone is secreted from the anterior pituitary gland, and alterations in this hormone are associated with secondary endocrine disorders. Serum calcium is primarily regulated by the parathyroid gland, and serum iodine is needed for synthesis of thyroid hormones. The patient experiencing thyroid storm is ordered to receive beta-adrenergic agents. Monitors for which therapeutic effect of these medications. So here the question is asking beta-adrenergic blockers therapeutic effect. Is it increased respiratory rate, increased appetite, decreased heart rate, decreased bowel sounds? Beta-adrenergic receptors stimulate increase in heart rate, cardiac muscle contraction and BP, while also causing smooth muscle relaxation in the bronchial tree. Beta-adrenergic blockers decreases the heart rate and BP by blocking the catecholamine access to the receptor sites. The nurse correlates a positive chiastic sign to hyposecretion of which hormone? Thyroxine, thyrocalcitonin, parathyroid hormone, triiodothyronine. Low serum calcium is associated with positive chiastics and positive trousseau sign and results secondary to decreased calcium at the neuromuscular junction, allowing enhanced nerve transmission. So this is because of the parathyroid hormone hyposecretion. The nurse monitors the calcium levels closely in the patient taking digoxin because hypocalcemia may lead to which complication? Elevated heart rate, dysarrhythmias, increased cardiac contractility, hypertension. Digoxin result in hypocalcemia. Decreased calcium levels are associated with QT interval prolongation, resistance to digitalis related to loss of inotropic effect, hypotension and cardiac dysarrhythmias. Calcium is required for contractility, that is the inotropic effect. So contractility decreases with hypocalcemia. So dysarrhythmias are a complication in patients taking digoxin. The nurse prioritizes which nursing diagnosis in the patient after partial parathyroidectomy. High risk for ineffective airway clearance related to hypocalcemia, high risk for ineffective breathing pattern related to hypercalcemia, high risk for hyperventilation related to hypersecretion of triiodothyronine, high risk for airway compromise related to insufficient iodine stores. Laryngospasm may develop secondary to hypocalcemia when the parathyroid glands are resected. With this laryngeal spasm, intubation is extremely difficult and the patient may require an emergency tracheostomy. The other potential respiratory complications are secondary to the potential of impaired airway. So, for a patient after partial parathyroidectomy, there is a high risk for ineffective airway clearance related to hypocalcemia. The nursing diagnosed acute pain related to urethral pressure and obstruction secondary to calcium containing renal stones is most appropriate for the patient with which endocrine disorders? Hypothyroidism, hypoparathyroidism, hyperthyroidism, hyperparathyroidism. Hyperparathyroidism is associated with hypercalcemia and hypercalciuria, leading to the development of renal stones. In addition to severe pain, these renal stones can also lead to obstruction and kidney damage. Ms. Matthews is a 28-year-old who presents with complaints of weight loss despite eating all the time, restlessness, insomnia, and changes in her menstrual cycle. On the basis of these findings, the nurse practitioner orders diagnostic evaluation of thyroid function and female reproductive hormones. Ms. Matthews' thyroid hormones T3 and T4 are elevated and her TSH is decreased. On the basis of these findings, she is diagnosed with primary hyperthyroidism. The nurse practitioner prescribes the patient to start propylthiouracil. Ms. Matthews is instructed to ensure that she consumes adequate fluids and monitors her weight weekly. Ms. Matthews returns to the clinic 2 weeks after starting the propylthiouracil because she has continued to have the same complaints of restlessness and insomnia and has lost another 6 pounds since her last appointment. The nurse practitioner discusses the option of radioactive iodine therapy, but Ms. Matthews refuses because she would like to get pregnant once her hyperthyroidism is controlled. Radioactive iodine therapy is contraindicated in pregnancy because of potential adverse effects to the developing fetus unless the potential benefits of the interventions outweigh the risk to the fetus and mother. She is referred for a surgical consult and the decision is made for her to undergo a partial thyroidectomy to remove the hypersecreting thyroid tissue. Which of Ms. Matthews' demographic variables are consistent with a diagnosis of hyperthyroidism? Age, socioeconomic status, occupation, race and gender. Hyperthyroidism can be present at any age but is most commonly diagnosed in women between the ages of 20 and 40 years of age. Here she is 28. It is also 10 times more prevalent in women, so gender. Race, socio-economic status and occupation are not related to incidence of hyperthyroidism. The nurse recognizes that the rationale for the administration of propylthiouracil is based upon which action of this medication decreases thyroid hormone release from the anterior pituitary gland, blocks conversion of T4 to T3, increases thyroid releasing hormone release from the hypothalamus, augments iodine absorption by the thyroid gland. PTU inhibits the synthesis of thyroid hormone by diverting iodine pathways and by interfering with the conversion of T4 to T3. Thyroid hormone is not released from the anterior gland and PTU has no direct effect on the hypothalamus. The nurse recognizes which rationale for the instructions to Ms. Matthews to increase her intake of fluid secondary to her hyperthyroidism. There is an increased water loss because of the hypermetabolic state. There is increased blood flow through the renal system. There is a decreased availability of TSH. There is increased water reabsorption in the GIT. Hyperthyroidism results in an increase in insensible fluid losses secondary to the hypermetabolic state. Hyperthyroidism does not impact renal blood flow or water absorption in the GIT. TSH is regulated by the anterior pituitary gland and has no direct effect on the fluid balance. So here there is an increased water loss because of the hypermetabolic state. What is a nursing priority for Ms. Matthews in preparation for the thyroid surgery? Maintain weight loss at less than 2 pounds per week, increase intake of green leafy vegetables, heart rate within normal parameters, decrease intake of calcium. Surgical management may be indicated for patients with hypersecreting tumors unresponsive to the medications. Because most patients experience hyperthyroidism while being prepared for surgery, it is a priority to establish normal or euthyroid function prior to surgery. Normal heart rate and stable weight are consistent with euthyroid. That is why heart rate should be within normal parameters. Continuing 2 pounds per week weight gain is consistent with management of hyperthyroidism. The nurse recognizes which action of radioactive therapy that impacts women during their childbearing years. It interferes with production of estrogen, it decreases blood flow to the placenta during pregnancy, it interferes with normal menstrual cycle, it may adversely impact fetal development. Radioactive iodine therapy is contraindicated in pregnancy due to the potential adverse effect to the developing fetus unless the potential benefits of the interventions outweigh the risk to the fetus and the mother. So here the answer is it may adversely impact fetal development. Hope you understood this video on thyroid and parathyroid disorders. Thank you so much. Please do keep watching the videos.